So moving on to the introduction. Food-related illness in which the immune system is involved, it is known as food allergy, and in which the food system is not involved is known as your food intolerance. Generally, people confuse these two terms, but there is a whole different meaning to both. Okay. Next, we will see how is the mechanism of adverse food reactions. See, so we have toxic and we have non-toxic food reactions. Okay, toxic will give you non-toxic will give you hypersensitivity, and hypersensitivity will lead to allergic hypersensitivity or non-allergic hypersensitivity. And allergic hypersensitivity is happening because the immunological mechanism is involved or suspected, and non-allergic hypersensitivity is occurring because there is no immunological mechanism is yet proved. Okay, so allergic hypersensitivity is again IgE immunoglobulin mediated, and again we have non-immunoglobulin mediated. Okay, so food allergy, helminths or intestinal parasites will occur because of IgE mediated, and under non-IgE mediated we have antigen antibody or IgG and IgM complex hypersensitivity, IgG mediated and T cell mediated. So these are all related with your the immunoglobulin response. Okay, now moving on to non-allergic hypersensitivity, which does not involve any immunoglobulin mechanism. We have food intolerance, enzymes deficiency. It's happening because of food additives, food irritants, and food indigestibility. These are factors because of which this is occurring, and also we have psychological reactions and drug reactions, etc. Okay, so now we will move on to what is food allergy. It is an hypersensitivity or an abnormal response to a food by our immune system. The non-toxic allergic hypersensitivity is immune mediated, that is immunological mechanism is involved or it is suspected. Okay, as said earlier, antibodies and are immunoglobulin produced by plasma cells in response to an antigen or allergen. This, I think, physiology, when you're doing a physiology topic, it has been already covered. Okay, so people who do not know, so this is basically what antibodies are. Okay, when the body's immune system mistakenly believes a harmless substance is harmful to the body, it tries to protect the body by releasing histamine and IgE antibodies to attack the substances. Okay, so this is how our immune system responds. 5 classes of antibodies have been identified: immunoglobulin A, that is IgA, immunoglobulin D, IgD, immunoglobulin E or IgE, immunoglobulin G, IgE, and immunoglobulin M or IgM. Okay, so these various classifications I hope you've studied in your higher secondary classes. Okay, and it is also covered in your physiology chapter. So if you do not know, then you can always refer to your older books and older texts, so it will be easier for you guys. Next, we will see what are the types of allergic reaction. Okay, see, we have type 1, type 2, type 3 and type 4. Type 1 is again the same, immediate hypersensitivity, anaphylactic, or which is IgE mediated or immunoglobulin E mediated. Type 2 is your cytotoxic hypersensitivity. Type 3 is Arthur's reaction, antigen antibody or IgG and IgM complex hypersensitivity. And type 4 is your cell mediated immunity or delayed hypersensitivity. Okay, so these are the types And on your right hand side of the table, you can see the types are mentioned in more details. So let me just give you a quick go through of the same. This is the quick onset of food allergy, your type 1. Okay, the reaction occurs when an allergen reacts with sensitized IgE antibody on mast cell. Okay, so mast cell is there in your body. If later down we will have an illustration of how this will react, so I'll just be reading through. This leads to degranulation of the mast cell, releasing mediators such as histamine, cytokines, etc. Okay, so if it is getting attached to the mast cell, then it will liberate histamines and cytokines, okay, which will, it will show signs that your body has taken something which the body should not have been taken, or something is going into your cells. So these are alarm clock sort of things, which causes adverse reactions. So reactions here are your alarm clocks. In certain circumstances, IgG has also been involved in this type of reaction. Okay. Next we have type 2. In this reaction, IgG antibody reacts with the cell membrane of an antigen associated with the cell membrane and fixes complement, okay, which leads to complement mediated cell death. It is not usually thought to play a role in food allergy. So what you can say is the basically type 2 is not happening because of your food allergy. It's like it can happen because your body comes in contact with an antigen externally also. Okay, so not necessarily the source has to be food. Okay, so type 3, in this type of reaction, antigen and antibodies, IgG and IgM complex form complex to induce complement fixation and consequent local inflammatory response several hours after exposure to antigen. Okay, so basically here, if an antigen is exposed, then the IgG and IgM together they form a complex and then induce a complement fixation, and then what happens, an inflammatory response is happening in the from because of the production of the complex. Okay, this reaction may have a role in several food related inflammatory diseases such as colitis, enteritis with bleeding, and malabsorptive disorders. Okay, so this is a type which is happening because of your food allergy. Type 4. This reaction is mediated by T cells. Okay, T cells interact directly with antigens. This type of reaction may have a role in celiac disease, protein losing enteropathies, inflammatory bowel disorders such as ulcerative colitis. So again, this is directly related to your food allergy. Okay. So the allergy reaction process. So here is a illustration of that is entering your body. It will go and combine with the cells, and then with the T cell receptor, and then with the help of the helper cell, it will be carried out in your blood system until and unless it will go and meet the mast cell, where it is binding with the IgE receptor of the mast cell. Okay, after binding with the IgE receptor of the mast cell, there will be formation of complement fixation, and this will lead to the release of your components such as histamine, leukotrienes, and cytokines or chemikines. Okay, which will induce itching, swelling, nausea, vomiting, cramps, and diarrhea in the body. Okay, so the longer process of allergy reaction is the systematic reaction, and after that, when it reaches to the mast cell, then you will have a localized reaction. Okay, so this is how it is affecting the body, or this is how the immune response is responding in our body to a particular allergen or by producing a reaction denoting that whatever the person has consumed or whatever the person has come through or passed by is not suiting in the body. Okay, so these are the symptoms that are produced after the allergy reactions. Okay, gastrointestinal manifestation, skin cutaneous manifestation, respiratory manifestation, systemic manifestation, and neurological behavior also changes. So under gastrointestinal we have abdomen pain, nausea, vomiting, diarrhea, gastrointestinal bleeding, colitis, distension, protein losing, enteropathy, which is very common, and it is actually seen after consumption after consumption of food. It will prevail like after like 1 to 2 or 4 hours later. Sometimes it might even take a longer period of time. Okay, skin cutaneous manifestation. Okay, this symptoms is generally generated easier at a faster level than the gastrointestinal manifestation, because when your body comes in contact there is an immediate response. Okay, because it is because it is in from your cutaneous membrane or the skin. Itching, flushing, urticaria, angioedema, swelling of the blood vessels, eczema, erythema, skin inflammation, redness. Okay, so these are very these ruptures occur faster, and you will get to know whether you are having an allergic reaction, whether you've had allergic reaction to something or not. So the symptoms are visibly faster. Respiratory manifestation: runny nose, cough, airway obstruction, airway tightening, wheezing, laryngeal edema, asthma, rhinitis. This is comparatively the symptoms that these symptoms are generated comparatively faster than your gastrointestinal, because the allergen has to set in your body, and then the antibody is produced, so it happens at a less slower level than the skin, but faster than your gastro. Okay, systemic manifestation is failure to thrive, anaphylaxis, hypotension, and dysrhythmia. So these are the systemic manifestation. It happens like for a longer period of time. When you're exposed to something for a longer period, then you have this following symptoms. Neurological behavior: you have a headache, irritability, and restlessness. Okay, so this is also one behavior which people portray when they are having food allergy or any allergies. So now we will go into the risk factors for the development of food allergy. Okay, causes of food allergy reaction can be two, which are your common food allergens. Okay, food with high protein content, usually of plant or marine origin. And next you have your risk factors, which are because of hereditary. It can be because of atopy, antigen exposure, GI permeability, okay, amount of antigen presented, and environmental factors. Generally the common food allergens are the causes which we generally find common in our day-to-day life, but the ones with the risk factors are very difficult to handle sometimes, and these are the main this is the main area which needs lots of importance. Okay, so because when a person is having food allergic reactions and the risk factors are high, so they need to have particular treatment. So the risk factors involved here in the causes of allergic reactions, the one creating the causes, are of more importance, because people with such risk factors, we have to concentrate more on the nutritional management, more on the treatment of the person, of their lifestyle. Okay, because it is a genetic because sometimes it is a genetic defect that is in the body of the patient, which will lead to various kind of allergies. So in order to find out, we have allergy tests, and we go through long measures so that the patient might not be having any malnutrition in the body. Okay, so initially we identified the cause of the allergies. Okay, there are various tests which we have to go through in order to know the particular allergy, what is causing the food allergy in the patient, which food is causing an allergy in the patient, okay, whether they have certain types of enteropathy or not. So these are of main focus for a dietitian or a doctor. So most common food allergens we find in milk, tree nuts, shellfish, peanut, fish, wheat, egg, soy. Okay. While more than 160 food can cause allergic reaction in people with food allergies, these 8 foods account for 90% of the food allergic reactions and are the food sources from which many other ingredients are derived. Okay, some people have allergy to the sources directly. Okay, so we exclude them in the diet, but if some people might also have allergies when these are utilized as an indirect source as well. Okay, now we'll go to the summary on food allergy. Food allergy, what is food allergy? It is an abnormal reaction of the body's immune system to a particular food. Food allergy reactions caused by the immune system, either it's IgE antibody mediated or delayed non-IgE mediated allergy. Okay, affects multiple body system, that is your gastrointestinal system, respiratory system, skin, cardiovascular in severe cases. Okay, exposure can cause serious problems or death. Common food allergies, about 90% of the food allergies are caused by 7 foods: cow's milk, hen's eggs, soybean, peanuts, tree nuts, almonds, Brazil, cashew, and so on, wheat, fish, and shellfish. The remaining 10% of allergies are caused by a wide variety of other foods. Okay. So with that we come to an end on food allergy. So now we will be discussing on the food intolerance. Food intolerance, as we have discussed earlier, it is different from your food allergy because here there is no immunoglobulin related. It is not related to immunoglobulin response. Okay, rather it is related to non-allergic hypersensitivity, which can occur because of various kind of reasons. It can be also triggered by a physical reaction to food or food additive, or caused by a metabolic reaction, and because there is a deficiency of certain enzyme. For example, in case of milk, you cannot digest the lactose protein that is in milk because the body is not having proper build-up of lactase enzyme. Okay, and by pharmacological agents in food, by food poisoning, ingesting contaminated or spoiled fish, or a food idiosyncrasy such as sulfite-induced asthma. So these are all that will lead to your food intolerance. Next, we are going to see what are the factors that may contribute to food intolerance. Enzyme deficiency or defects. Lactose intolerance, as said, lack of lactase may cause cramps, vomiting, diarrhea, abdominal pain, etc. Okay. Phenylketonuria is the lack of enzyme phenylalanine hydroxylase, which can cause damage to the central nervous system, because here phenylalanine is a amino acid which is obtained by consumption of food. Okay, if this enzyme is not present, this phenylalanine hydroxylase, then there will be an extra build up of phenylalanine in the body, so it will be difficult to liberate it from the system of our body, and it might cause a blockage in the central nervous system because of the building up. Okay. Galactosemia, or it is a lack of galactose 1 phosphate uridyl transferase, causing vomiting, fever, jaundice, etc. It happens when the body is not able to metabolize or digest simple sugar, which is your galactose. Okay. Next we move on to naturally occurring food chemicals or pharmacologic effect. Pharmacologically active substance induce vasoactive amines such as histamine, tyramine, tryptamine, phenylthylamine, and serotonin. Reaction to food additives, tartrazine and sodium benzoate, benzoic acid. These are certain food additives which some people are allergic to these food additives. Okay, so it might be causing hives, rash, and asthma in their body. Monosodium glutamate or MSG, causing headache, nausea, flushing, abdominal pain, and asthma. It is also a type of food additive, or mainly used in Chinese food. Okay, Chinese cuisine. So people who tend to have allergy to Chinese cuisine might most probably consuming because of monosodium glutamate consumption. Okay. Reaction to microbial contamination. The illness described in case 5 above. Microbial contamination, it is occurring because of fish poisoning, which results from the ingestion of histamine-like substances formed when bacteria degrade the fish of certain marine fish. Okay, so this is sort of your toxic food poisoning again, sort of like that. And food indigestibility. Food includes fructose, xylitol, sorbitol, cellulose, hemicellulose, lignin, gums, etc. can lead to bloating, flatulence, and diarrhea. Okay, so these are all your food factors which may contribute to the intolerance of food in a human body or in the body of a patient. Diagnosis process using the targeted elimination diet. Okay, so we've studied earlier that elimination diet is a type of diet in which you will target to exclude or eliminate all sort of sources of food sources that is giving allergy, or because of which the patient is having allergy. Okay, basically it is the elimination of certain specific food which is producing allergy in the patient. It can be specific food, or by wholesome food, or also the indirect food in which the allergy is induced. Okay, for after removal of the specific food in a patient, then the patient improves, reintroduce suspect food to the diet, symptoms reoccur, re-eliminate suspect food, and perform double blind food challenge. Okay, so these are the process. Next there is one more process. What we do is we eliminate the specific food in a patient, then we see the symptoms that are persevere but appearing, and then we stop the elimination diet, evaluate other reasons for illness. Okay, so this is how we do the diagnosis process using the targeted elimination diet. Next we move on to implementation of the severe elimination diet. Then there are two methods. By symptom cease, begin normal diet, or if the symptoms persevere, then what we do is we stop the elimination diet and evaluate other reasons for illness, like we've done earlier as well. If the symptoms cease, and then we begin the normal diet. After beginning of the normal diet, if we see that the symptoms cease, then it is well and good. Otherwise, if we see that the symptoms persevere, then we reinstate the elimination diet. Then after the reinstallation of elimination diet, if the symptoms cease again, then we reintroduce one food every 2 to 4 days. Okay, two things can happen, that is the symptoms might occur again or the symptoms might abolish. If the symptoms will abolish, then we continue the reintroduction of the food which were initially eliminated. After that we will see we will list the tolerable list the foods that are tolerable and intolerable to the patient. Okay, if the patient after the reintroduction of food every 2 to 4 days, if the symptoms still occur, then we omit casual food, keep diary of events, and eventually up till the symptoms will cease. So this is how a severe elimination diet works. Okay, so initial one in which the after with the introduction of elimination diet the symptoms persevere, we stop the elimination diet and evaluate other reasons for illness. This is a very short approach. And and the other one in which the symptoms cease and then we begin a normal diet, and then we see after beginning of normal diet what will happen. And so this is a longer approach. Okay, so after the implementation of severe elimination diet, these are various steps are there in which how we handle the food intolerance in the patient, what we do, what is our output. The basic output is that we have to categorize the food which are tolerant to the patient and food which are tolerant to the patient and the food which are non-tolerant to the patient. Okay, so so that the patient would maintain it in a strict way. And after maintaining all this, the patient, what foods are there to be included in a diet to the patient, those are all discussed with the patient, and he has to be counseled very well so that he does not tend to eat the food which are not tolerable by his gut or by his body. Okay. So moving on to the management of food allergies. Management of food allergies include three types. Okay, diagnosis, we see the history, physical examination, food symptoms, biochemical immunological test, and food elimination. Okay, then we have your after that we go to your medical management, which is if you find in acute cases, introduction of drugs in the body in severe cases. Okay, and then you have your nutritional management, which is reintroduction of foods by food challenge and avoidance of food allergies, provide alternate food. Okay, the four general principles of allergy management include: avoid factors that cause symptoms, is the initial factor. Factor number 2 is use appropriate medication. Factor number 3 is evaluate for immunotherapy, and 4 is educate and follow up with your patient. Management of food allergies include your primary prevention, secondary prevention, and tertiary prevention. Primary prevention is focusing on blocking the sensitization and development of IgE mediated response. These strategies would be useful for those who have an atopic disposition but no sensitization. Okay, attempts to inhibit expression of the disease despite sensitization. These are used for the patient who have been sensitized but do not express the disease or only expresses one type of disease. Example is your atopic dermatitis but not other disorders. Example, asthma. Okay, tertiary prevention targets the control of factors that cause symptoms. This strategy would be appropriate for patients who have expressed a disease and needs to limit symptoms. So these are the types of prevention methods that has been used for the management of food allergies. Here it is stated that encourage patients and family members to read labels. Okay, read labels means when you're buying a food product, you make sure that the patient or their family members always go through whatever is printed in the label. Okay, not the composition of the food, from which the food is made, that means the source of food, whether it contains wheat or not, very essential if the patient is having celiac disease. Okay, if the patient is suffering from any kind of food additive disease, then they should be knowing what kind of food additives has been utilized in the food. Okay, it is all printed in the package of the food, generally on the back side of the food product, so we encourage them to read and then buy. So this is how certain managements are done. Okay, in respect to energy, carbohydrate, protein and fat, since it is, if for the energy maintaining of the body, we maintain a regular energy for a male patient and a female patient, sedentary male and female, however the energy is supposed to be maintained. Okay, so by the help of Harris-Benedict equation, we can also calculate the daily amount of energy that is to be given to the patient. Okay, and in case of carbohydrates, it is good if the patient is not suffering from any carbohydrate metabolic disorder or any kind of enzyme deficiency disorder. Okay, so for patients suffering from celiac disease or galactosemia, then they are advised to avoid, in case of celiac disease, they are advised to avoid wheat products, because celiac disease is caused because of gluten allergy. Okay, and gluten is a protein that is found in your wheat products, so you suggest the patient to avoid wheat in their products. And in case of galactosemia, as we already know, it is the incapability to metabolize galactose or simple sugar. So carbohydrate in the form of galactose is avoided in the patient. Okay, so they should not be consuming this simple sugar. Protein, again as said, phenylketonuria, if the patient is suffering from that disease, then they should be aware of the amount of protein they are consuming in the diet, because if there will be phenylalanine build up in the body, then it will be leading to complication in the health of the patient. Okay, again in case of lactose intolerance, just because the body is lacking in your lactase enzyme, so lactose is a protein that is found in your milk. Okay, so consumption of milk and any other dairy products is to be limited or totally eliminated in the diet of the patient. So these are certain foods and certain allergies, certain diseases that is caused because of food allergies, and this should be avoided in the patient. So with this, I would like to end the session. Thank you. In next class, we will be discussing something more about other food allergies or other immunity. Till then, bye.